On this episode, we visit the Big Dam Bridge upriver from Little Rock. Then we visit the Medical Mile in downtown Little Rock. We look at measuring the body mass index of school children in Arkansas. Finally, we learn about pedestrian issues in Cabot, Arkansas. Stay tuned. We're in Little Rock talking with Buddy Valines. What's this behind us?
Well, it's affectionately known as the Big Dam Bridge. We believe it's probably the longest pedestrian bicycle bridge ever built for that purpose. It's also the only bridge ever built where the dam that it was built over wasn't built for it. And they had to cut huge chunks out of it to drill the piers. It's become kind of an icon, a monument in this place.
How did it all get started? Where'd the idea for it come from?
Well, we had been working, the two mayors, the two cities, one on either side of the river and I, on a trail that ran along the river. Got out to this point and we talked about, well, how do we connect it? And there was an interstate highway bridge a little bit further west, but I looked at this and said, why not? And 8 years later, about 14 million total, it's in place and being used extensively.
What, other than time and money, what did it take to get going? You had people with an idea. How did it go from there to people walking across?
Well, it's actually the idea was myself and the mayor of North Little Rock, Pat Hayes. He takes 2% of the credit. The rest of it is county government. We did it. And it's just patience and perseverance. We had to work with the Corps of Engineers. We had to find the funds and then just stay after it until it got accomplished. Of the 8 years, 2 years was construction, the last two obviously. And that really, I think, is key more than anything else, is just making up your mind you're going to do it. It's going to happen, and then just staying with it.
Now that it's in place, what do people think of it?
Oh, they love it. We get over 100,000 people a year, easy, coming up. And once they've come one time, they come back. We've had every state in the union, several foreign countries visit. People like we have here this morning use it as really a center for physical activity. You'll see people here of all shapes, colors, nationalities, people who've not been off a couch in 30 years. Are now out here walking these trails and walking this bridge. And the beauty, once you get up to the top of this area, just overwhelming. I mean, it is just one of the prettiest places in the country, if not the world. And it's a migratory path of a lot of bird species. So people come here for a variety of reasons, but they all enjoy it. You get up there, a friend of mine's called it a palisade in the sky. And people are smiling. Little kids are just having a ball. It's just a great asset for our community.
And how does it fit into your larger trail system?
Well, between here and downtown of Little Rock and North Little Rock is 7.5 miles. There's a trail totally complete on the north side of the river. There's still got a couple of gaps on this side of the river, so you got a 14.5 mile loop tied together on that end by a railroad bridge that we've converted and another one to be converted. So it loops the whole downtown, and off of that become the spokes. Moving west from here, we have a trail continuing along the river with plans for another bridge over a river that comes into the Arkansas River. And then we've developed a countywide trail plan, all of which ties in here. It gives people the chance from anywhere in the county probably to access anywhere from 30 to 50 miles of trail, biking and walking.
What's the most important thing about something like this?
Well, that's a good question. This bridge, like any bridge, all the bridges in history connect people and places, and that's community building. People get up there with their families and friends, and they meet other people or see other people they hadn't seen in a long time. Secondly, health. This facility, because it does draw people and they come again and again, is a way to get out and exercise. Thirdly, economic growth. Well, like I said, we've had people from all over the country come here. And now we've got business and industry wanting to locate on the trail because they see it as an asset and benefit to recruiting people to this community and to their businesses. And then finally, I think when you do something this magnitude, when people see it, they get an idea that, if we can do something like this, there's a lot of great things we can do. And we've seen that happen here. I mean, people really, an attitudinal change of people saying, we can do big things, we can do great things. And we continue to add to the trails, and we'll continue to do things that I think people 10 years ago wouldn't have thought we could have done.
We're in Little Rock, Arkansas, talking with Terry Easton, who's co-chair of the 2008 National Trail Symposium. What is the National Trail Symposium?
The National Trail Symposium is a biennial conference that is held by American Trails, the foremost educational resource organization for education of trail construction techniques, of advocacy techniques, of maintenance, and all aspects of trail development and trail building. They chose to host the National Trails Symposium here in Little Rock, Arkansas this year. Their choice was predicated on their knowledge and interest in the medical mile of the Arkansas River Trail, where we're standing now, and the benefits of collaborations between recreationalists and the health community.
Okay, let's start first of all with the bigger picture. What's the Arkansas River Trail? Where does it go? What does it do?
The Arkansas River Trail is a 24-mile trail system, of which 17 miles are completed. Runs along the downtown riverfronts of both Little Rock and North Little Rock. It is anchored on one end by the Rock Island Bridge, which is attached to the President Clinton's Presidential Library. On the other end, it is anchored by the Big Dam Bridge. That creates a 17-mile loop opportunity. The Big Dam Bridge is the longest pedestrian bicycle-only bridge ever built by the U.S. Army Corps of Engineers, and it is over an actual lock and dam on the Arkansas River. A 10-mile extension is planned out to Pinnacle Mountain State Park, where it will connect with the 225-mile Ouachita Trail. As it stands now, the Arkansas River Trail connects 24 key tourism destinations via bike or pedestrian use. It connects 11 municipal, state, county, and federal parks with over 5,000 acres of preserved land. It has truly become an icon and a welcoming venue of the city of Little Rock and the city of North Little Rock.
Okay, it sounds like there's plenty to do along that trail.
Absolutely.
But you added more. We've got the medical mile here. What's it all about?
In 2003, I was hired by the city of Little Rock to help them find funding to finish their side of the Arkansas River Trail. The North Little Rock side of the trail was unique in that the city owned most of the riverfront land out to the Big Dam Bridge. In Little Rock, the trail traverses some of the most expensive land in the state of the Arkansas, some of which is valued at $27 a square foot. So it's been much more difficult to get this side of the trail finished. When I was given the task of finishing the Arkansas River Trail, I was told, Terry, we want you to help us finish the Arkansas River Trail, and oh, by the way, we don't have any money. So I created what was called a Headwaters Partnership of the Arkansas River Trail, 6 state agencies, 6 national organizations, 2 cities, Pulaski County, and then 32 smaller organizations, nonprofits, businesses, economic leaders, and so forth. From that, I was introduced to a local cardiologist who said, hey, our cardiology group would like to help with fundraising. What can we do? I met with their CEO and then their executive board, and then all 30 of their cardiologists. As it turned out, it's the state's largest cardiology clinic. I left the room while they voted on whether or not to support the Arkansas River Trail, and a few minutes later they came out of the room and told me that it was the first time in the history of their practice that they had ever voted unanimously to support an event. They agreed to raise $350,000 to create the medical mile over a period of 2 years. They raised $350,000 toward the medical mile project in 2 months. So the good sports that they were, they continued the fundraising program, and at the conclusion 2 years later, they had raised $2.1 million. The medical mile is a three-dimensional art walk that allows the donors to send a health message to community visitors and tourists worldwide. The premise behind the medical mile was that these organizations could not create advertising displays for their organization. They were allowed to use their logo, but they were required to develop a health message. And as you can see behind me, the Arkansas Cardiovascular Task Force chose "It's About Time," meaning if a person suspects they're having a heart attack or a stroke, the first 30 minutes is the most crucial and when the least damage is done, so get to the hospital quickly. The mural wall, which raised $225,000, is 1,300 feet long. We sold it at $1,000 a linear foot. Across from the medical mile are benches, landscaped arrangements, and trees that were all purchased at a cost of anywhere from $500 to $5,000. Most of those venues were sponsored by individual citizens or physicians. The fundraising drive was statewide. We received checks and donations from every corner, from physicians in every corner of the state of Arkansas. We were very fortunate. Our mayor at the time, Mayor Jim Daly, was instrumental in helping us with our major presentations. We were able to acquire $750,000 from 3 sponsors, one of which was Arkansas Blue Cross and Blue Shield, who wanted to do interpretive health messaging. They created the Wellness Walkway, part of the medical mile. Another was St. Vincent's Health System, which created the Gateway Plaza to the medical mile, and the focus of the Gateway Plaza is on the health of body, mind, and spirit. The third donor was a developer who owned a major property management company here in town, and he offered to provide $250,000 to help support a bridge over a major railroad at the end of the medical mile, and all he requested was that he have naming rights on the bridge. So that, combined with this extensive fundraising effort, led to the development and the creation of the medical mile of the Arkansas River Trail. It's located in Riverfront Park, which gets about 2.5 million visits a year. It has transformed the western side of Riverfront Park, the city's premier park, and once where people seldom, if ever, came to this end of the park, now on weekdays it is streaming with traffic. My favorite expression is you have to have blinkers on your backside to be able to get on the medical mile during the weekdays. We're planning a future connection to the state capitol so that state employees have the opportunity to walk in a safe off-road environment to and from downtown at lunchtime or breaks or other times to help with their physical fitness activities. Arkansas is by and large a very unhealthy state, and the premise behind Heart Clinic Arkansas's desire to support and help build the medical mile was that they believed they needed to take a more active role in prevention as opposed to finding the cure or treatment. That they have seen a rise in obesity to the level where 10 years ago they might get one person a year who was too large to be tested on their heart equipment. In the last few years, they've been up to about 5 or 6 a month of those people who are actually too obese to be tested or treated on using their heart machines. They've had to go out and buy new, larger size equipment to be able to care for their patients. They have been writing prescriptions for health. that people need to get out and use the Arkansas River Trail, 30 minutes of activity every day for better health, for prevention of chronic disease, and for living longer, healthier lives.
And you talked about the importance for this symposium of the partnership between the health community and the trail community. You've got the example here that you're showing off. Is this something that's catching on? That have the trail folks figured it out? Have the health folks figured it out elsewhere in the country?
Absolutely. 9 years of CDC studies told these cardiologists that communities with well-developed trail systems were by and large healthier than those without. And the statistics prove unequivocally that building and providing facilities for people to get more active is the most effective way to reduce illness and disease in states, communities, localities all over the country. I have been invited to speak in cities from Washington, D.C. to Portland, Oregon, Chicago, New Orleans, Minneapolis, all across the United States, and am now working with several communities to help them develop their own version of the medical mile. What you see here was an interpretation that was developed based on the wishes and desires of each of our donors, not a prescribed formula that was established where we went to them and said, we need this thing on the Arkansas River Trail, would you pay for it? What we did is we went to them and we said, we know that you have a message that is important to your organization. Let us create a three-dimensional art piece that reflects that message that people can get while they're walking at a rather brisk pace for health. And every one of the organizations that were participating loved the idea.
We're in Little Rock, Arkansas, talking with Dr. Jennifer Shaw with the Arkansas Center for Health Improvement. What is the center?
The center is established as a nonpartisan health policy agency that really is a catalyst to improve the health of Arkansans, and we do that through public health advocacy and through research and just programs and innovative programs in the state.
I guess first question is, what is BMI? What does it stand for?
BMI is body mass index, and it's basically an assessment of a height to weight ratio. In 2003, we started collection across the state for all public school students, where we collected both their height and their weight and calculated the body mass index, and then confidentially reported that back to parents so that we could raise awareness about where they were on the continuum of obesity risk.
And parent gets a report from the school saying BMI might be high enough to be of concern. What could a parent do then to address the issue?
Very good question. Again, the parent reports that were sent home basically said, this is what BMI is, this is what it means to have this particular BMI, and then it gave some strategies that parents could institute in terms of better nutrition practices, more physical activity, less screen time, and those kinds of things that parents could do to really either negate the risk of obesity that the child may have, or to sustain a normal and healthy weight if they had a normal and healthy weight.
And looking at the aggregate statistics you've been collecting, what sort of patterns have you seen?
We've definitely, like I said, yearly in the beginning, we collected over 450,000 BMIs. So we actually have a good surveillance system, and we've shown that about 38% of our Arkansas school-age kids are either at risk for overweight or overweight. And along the course of the last 4 to 5 years, we've shown that has halted, which is fortunate considering the trends in the national data of childhood obesity rates on the rise.
And from a broader public health standpoint, what can be done, other than what individual families can do, but on the broader basis, what can be done to address concerns about overweight and obesity in children?
Actually, there's sort of two-prong approach, and it's really multifaceted. The state undertook a lot of initiatives and a lot of activities to really combat childhood obesity, and we're looking at ways to ensure that parents and children and community members have access to healthier foods and better nutrition practices, but also that they have increased physical activity and the opportunity to do that through safe and secure built environments, neighborhoods, and that kinds of things, parks, trails. And we are actually looking at innovative strategies and mechanisms to really generate interest and societal desire for more physical activity and better nutrition through programs such as the Safe Routes to School, where we look at ways that kids can walk and bike to school, and also through community gardens and through working really with non-traditional partners. How do we bring together law enforcement officials and wildlife officials and gardening clubs and school administrators and mayors, and how do we really bring those people together to really look at solutions and best practices that are really going to halt this epidemic?
And you mentioned that you leveled off here. You're avoiding the national trend that's still going the wrong direction. Do you think having the information out there, having collected the data, has helped with that?
Well, like I said, we really took a shotgun approach, if you will. We looked at vending machines in the school. We looked at reporting out pouring contracts, meaning that the schools had to disclose how much money they were getting from these vending relationships. We also looked at, like I said, increasing physical activity in the schools, and BMI was just one part of that. So I really think that through our collection efforts and through our statewide efforts that really we've generated an awareness, if you will, in the state that childhood obesity is a problem, it is an epidemic, and it is something that we need to be focusing on.
We're in Cabot, Arkansas, talking with Kelly Coughlin. What is Walkable Cabot?
Walkable Cabot is a plan that we implemented so people in our community would be able to tell us where most sidewalks are needed.
And what sort of process did you go through to get the community input on it?
We carried out probably about 4 separate interviews where people came in and we had maps, very large maps drawn out for people to be able to tell us exactly where they felt that pedestrian safety was at an issue. And so that's where, that's how we got that. We went, we kept going back and saying, okay, is this right? We would go and fix it and say, is this right? Is this the way we want it? And they would all agree, yeah, this is one, or we want to add this to it. And so our community put a huge amount of effort into doing it.
Once you got the plan put together, did the city adopt the plan then?
It took them probably about 6 months to 8 months to be able to adopt it. They had a master street plan that didn't put in effect. It was before all these schools were built. We have 5 schools within a mile radius, and so they didn't put that into plan with the master street plan. And so we had to go back and show them that's why we needed this walkable Cabot.
So once the city's adopted the plan, what's involved in having the plan implemented?
What's involved right now is that we need money. I guess that's the answer to all, is to have money. We are working on a little bit of that. We're looking at trying to get the grant for the safety routes to school right now and see if that might be possible. We're hoping that's possible, but since we have 5 schools right here within a mile radius, I think without the kids not being able to walk, I really think that might be a possibility of getting that grant. And if that does, then we won't have any problems. But the city has agreed to start working on at least getting this highway started. Since we did have the pedestrian death, that made them sit up and notice that, yes, we're going to have more problems here. So they have decided that they will work with us and try to keep the grass mowed for right now. We've had some issues with them not keeping the grass mowed. So we're hoping. We'll see what happens.
And you mentioned the pedestrian death. Just what happened at the crosswalk here?
There was a game, a Friday night football game, and it started raining. And so at halftime, and the band didn't get allowed to play because it was raining. And so everybody was leaving. And as this gentleman was leaving, he was crossing the crosswalk right behind us. And when that happened, a motorcycle who didn't want to wait came around him and hit him, and it killed. He was in the pedestrian crosswalk, and it killed him. And his wife, I think, got seriously injured as well. But they were here to watch their daughter play band, and since she didn't, they left early at halftime. So it was night, it was raining. And that's the other thing that I realized very quickly about the Walkable Cabot plan is you can have the best possible plan in place, but without people being able to understand the laws of pedestrian right-of-ways, we can't do anything. And one of the things that we're going to try and do is to possibly try and create a campaign for Arkansas, because I was in California for 15 years, and they all had "It's the Law" stop for pedestrians and crosswalks. And that's one of the things that we're going to have to really work on, is to get that understood, and just kind of get people to understand that it goes both ways, and pedestrians also need to know what their rights are to be able to walk crossing the crosswalks as well. And so we're trying to see what happens. The Arkansas Children's Hospital had a grant where they're working on the safety routes to school part of it, and we're going to be working with them as well. And so I'm hoping that maybe they will pick up the campaign for getting kids safely across the crosswalks and getting them plans in the schools. We need the plans to go into the schools and teach them, and not just pedestrian but bicycle safety as well.
And what can be done at the city level, and where do you really need the state's help to get things done in terms of either infrastructure or education or enforcement?
We need education, I think, is the number one. The school boards need to understand that safety does rely on them for these kids that are leaving school. It doesn't just stop when they walk off the campus. They need to make sure they have safe routes in order for places to go. With the gas prices going up so much, we saw such a huge increase of kids walking to school. The buses don't go all the way to they're a mile, less than a mile, and so these kids had no other option. Their parents couldn't drive, and so we need the schools to understand that, and they need to step up and actually go and enforce if that's a good enough word, and have them also play a big role in going to the city and the state and saying, hey, we need this. We need them to step up and take more, just a better initiative in it is what I'm trying to say.
Visit us on the internet at www.pedestrians.org.